Welcome to the Thyroid Fixer podcast. I'm your host, Dr. Amy, and we're diving deep into the world of hormones, especially for all you fierce women in perimenopause and menopause, and anyone dealing with hypothyroidism. If you're struggling with weight gain, you feel like shedding those pounds is an impossible feat. If you're dealing with plummeting energy levels, gut-wrenching fatigue, or a libido that seems to have left town, then you're in the right place. And don't even get me started on the hair loss. If these symptoms are sounding all too familiar, you've found your tribe. Welcome, because my goal is to educate, empower, and shake up your world. I want you to embrace every inch of that badass woman that you truly are. So if you're ready to dive in and fix things, let's get started. So this is going to be a game changer for you, and you can probably hear the excitement in my voice. The latest introduction, the latest member of the family to the Fixer line is Metabolism Fixer. And this, oh my God, I formulated this just for all my people out there that need to lose weight, that need help in the weight loss department, that can't lose weight no matter what they do, that feel like they have a slow metabolism, and that might be thinking of trying all those peptides out there, you know, the Beverly Hills soccer mom drug of choice for weight loss peptides. Or even if you're on them already and you're like, man, these are really expensive and I'm still not losing weight, add in Metabolism Fixer. Here's what I did. I took the power of T2, which increases your basal metabolic rate while you are sitting there watching Netflix. You're burning fat while you're watching Netflix. I combined it with a very unique patented ingredient called Suppressa. Suppressa has multiple clinical trials backing its efficacy in reducing your appetite, decreasing snacking, and providing way more control over your food intake. It is amazing. We also see improved emotional well-being, just decreased food cravings all around, reduced hunger, and weight management. Add on top of that, we have green tea extract. We have purple forest purple tea extract, both of which affect the metabolism in a very positive way without the jitters of normal fat burning supplements out there from the 1980s and 90s, right? The ones that made you feel like you're having a heart attack. You will not have that in any of my supplements, Thyroid Fixer or Metabolism Fixer. But Metabolism Fixer, ooh, yeah, we kicked it up a notch. It is in powder form, so you can drink it through your day. It's going to flavor your water. We got orange crush and refreshing citrus. I love them both. It is going to keep you under control all day long. So you throw a couple scoops in your water bottle in the morning, throw a scoop or two in your water bottle throughout the day. You will have fat burning and appetite control the entire day for what? An eighth of a price of the peptides? Oh my God, you can't go wrong. So grab some Metabolism Fixer today. Please let me know how you do on it. I am super excited for you. Super excited. Big old question I get all the time, and I see it in the Facebook group as well, is when should I change my medication? We're going to go over that today, but there are so many different tiers of this answer. It really kind of depends on where you are in the grand scheme of your thyroid journey. So first of all, we have to start with, are you on T4 only? Many of you are that are listening to this. And I'm going to say it once, if not a million times, T4 only doesn't work. It doesn't work. 2% of the population, and this is a stat that is published, 2% of the population do well on T4 only, 98% need T4 and T3. Of that 2% that apparently do well on T4 only, quote unquote, I would argue, are they overweight? Can I interview that 2%? Can I see how their energy levels are? Maybe they think that that's just normal and they say that they're doing well, but really if you look at them, their hormones are in the tank, they're insulin resistant, they're carrying an extra 20 pounds, they can't sleep, they don't poop every day, their hair is falling out, but they think that that's the new norm. They think it's fine, but it's not fine. That's not a way to live. You're not supposed to live that way. That's not how your body operates. So actually, I would argue that 100% of those with hypothyroidism or Hashimoto's need T4 and T3 together. So the first big answer, when should I change my medication? If you're on T4 only, you probably need to get a new doctor, but you need to change your medication because if you remain on T4 only, you will remain sick. You will stay with all of the symptoms that you have now. And it won't matter how many gut healing, adrenal fixing, hormone balancing, weight loss, detox programs that you do, you are never going to get better. You might notice some temporary relief, like, oh, yeah, I did this detox and I felt better for like a day or two or a week. And then all my symptoms came back. Oh, yeah, I did this fad diet, this weight loss program thingy dingy that somebody had out on Instagram, and I lost some weight and then it all came back. You can't be on T4 only and think that you're going to get better. So that is rule number one. If you are on T4 only, you need to change your medication. I don't know whether you're going to need to go up or down in your T4 or take it out completely. I just know that you're going to need some T3 added in. So when do we change our medication looking at T4? So even if you're on a blend of T4 and T3, maybe you're on Armor, NP, or you're on Synthroid Levo plus T3 Lyo, you still have to look at that reverse T3 every single time you test your thyroid. You better have reverse T3 tested. It's funny, just the other day, I saw labs from someone, I believe this was in the Girl Fix Your Thyroid Facebook group, posted, I'm reading them. And it started off with, I'm seeing a functional or integrative doctor. And here's the labs. What should I tell her to change? I'm like, well, first of all, she's calling herself integrative, functional, but there's no reverse T3 on here, and you're on Armor. This woman was on 100 and, I don't know, maybe 20 grams of Armor. Like, well, we can't tell anything. How about that? And she should know that we can't tell anything. You test that reverse T3 every single time. And if it's not tested every single time, that is a red flag that you are not with a doctor or practitioner that knows the thyroid. You test it every single time. So we didn't have a reverse T3 on her. So we don't know what to do with that T4. We need a reverse T3 on you to know what to do with your T4, whether you're on Armor, NP, or Synthroid, Tirosint, Levo. That reverse T3 is going to tell us whether or not we need to drop it down, raise it, or keep it the same. Scenario. Someone comes back with a reverse T3 of a 17, and they are on 120 milligrams of Armor, split dose 60-60. What do we do? T3 aside, we're not even looking at the T3 yet. We're just looking at the reverse. What do? We lower that Armor. With the reverse T3 of a 17, I would probably take that Armor down to probably 90, 45 and 45. And then we would add in T3. So then we move over and we look, what's that free T3 level? Oh, that free T3 level is at 3.2. So we can go up. So we're pulling away the Armor. We're pulling away some Armor. We're pulling away 30 milligrams of Armor. Now, we're not going to do an equal amount of T3 because in that 30 milligrams of Armor, there's probably only about, if we do quick math, 5 to 6 micrograms of T3. We want to add in more than that. So we would probably drop that Armor. Then we would add in liothyronine, most likely 5 twice a day, maybe 10 micrograms twice a day. And then have her do that, blend that together, retest, and see where she goes. Now, we're also going to come back and say, how do you feel? Right? Because those 4 important words are the most important words that can be asked to any patient, including you. So if you're not hearing, how do you feel when your doctor's looking at your labs, then that's a problem too. Time to get a new doctor. I always say, okay, thanks for your labs. Now, how do you feel? Tell me how you feel. Because I can look at labs all day and guess, but ultimately you are experiencing it. You're experiencing your life. Tell me how you feel. And then that is going to be paired up with your labs to determine a dose change or a med change. Let's say someone has a reverse T3 come back and it's a 5. It's actually flagged low. Now, do we care that it's low if they've been intolerant to T4 in the past and they have a tendency for an elevated reverse T3? No. If you have found your jam and you have found that, listen, I do so well on T3 only, or I do amazingly at this 25 microgram Synthroid dose plus T3, wherever that is, 20 twice a day, 25 twice a day, whatever, then we're not going to add in T4. But if we have a newbie who has never been on thyroid medication, obviously has a thyroid problem. We need to start them on some medication. And that reverse T3 is really low. I'll start off with 25 micrograms of T4. I'll start off with 30 milligrams of Armor. Let's just see how you do with that T4. But at the same time, we're always going to have some T3 in, whether it's in the form of liothyronine or Armor, we're always going to have T3 in that mix. So you have a low reverse T3. That tells us that you're converting well. And let's get it out of the flagged low. Let's bring it up to a 9. You have a reverse T3 of a 9. Okay, well, we can try to increase your T4 a little bit because that tells me that you are converting. So as long as you haven't had conversion issues in the past with a history of an elevated reverse T3, then let's try to go up in the T4 a little bit. But at the same time, we're going to go over here. We're going to look at that T3 level. And we're going to say, do you need a little bit more of that T3? If your T3, again, is coming in low and at the same time, and I'm not flagged low, I mean low in the functional optimal range, which we have a download on the website. If you don't know what the functional optimal range is, you go to the website, get the free download. That way you'll have all the labs to get and you'll have their optimal ranges too. It has to be in that functional optimal range. So let's say she is low per the functional optimal range, meaning she's coming in at like a 2.8. Then yes, we want to increase the T3. 100%, we want to increase that T3 to bring that level up and to also pair up with symptoms. Patient reports back, I'm still gaining weight. I'm still tired. Yes, I'm on T3, but not quite enough. So that's where we add in liothyronine and we keep climbing. We do that slow climb. Now, my patients know, because I have specialized training videos for all my patients know that when you increase T3, you do it slowly. And I train you in how to listen to your body. So this is something that is a little bit too complex for podcast purposes. But when you're increasing T3 in a nutshell, you can increase by 5 micrograms a week. You can increase by 10 micrograms a week. You can increase by 5 micrograms every other week. You can increase by 2.5 micrograms. So it's all dependent on you and how you're feeling. So when we're increasing a patient's T3, always split dosed, and we just do it slowly. So sometimes we're baby stepping our way up, and sometimes we're quick stepping our way up, depending on their tolerance level. Very personalized, but you always want to increase your T3 slowly, but you want to have T3 in the mix. Maybe that reverse T3 is low. It's a 9. I'm going back to that. Reverse T3 is a 9. And the person is on Armor. Do we want to add in T3? It depends. If they're doing really well on the Armor, maybe we just go up in the Armor because they're tolerating it. I don't necessarily want to throw liothyronine in the mix if they're doing well. It's like, if it ain't broke, don't fix it. This is my whole point, ongoing point of thyroid being a nuanced art. I'm giving you details here and scenarios that maybe you'll fit into, and you'll kind of know, oh, maybe it's time to change my med. Maybe it's time to change my med. But I want you to hear the fact that this is nuanced. This is detailed. This is unique to you. This is why you have to be working with a thyroid specialist, because it's just so detailed. Another example, my nurse practitioner sent me labs from a patient that we have. And I looked at the labs, and first question was that it was a low free T3, like really low, flagged low. I said, how long did she go between her last dose of T3 and the labs? That's the first question. Because whenever I see that free T3 low, and this goes for you guys too, this is where you can apply this to your labs. Whenever I see that free T3 low, I always think that they go too long. Most of the time when I ask that question, I'll get the answer of, oh, yeah, I went 2 days. Go back, redo it. Oh, yeah, I went 30 hours. Go back and redo it. We went 18 to 24, 18 to 24, 18 to 24 hours with no T3 before your labs. That is where you're going to get that accurate result. If you take it too soon, if you take it 16 hours, 14 hours, 4 hours, 2 hours, you're going to get a high free T3. It's not going to be accurate. If you take it too long after that 24-hour shutdown, now that T3 is dropping and we don't really know what your actual number is. 18 to 24 hours, no T3 meds before your labs. Then we get those labs done, then we can go somewhere. So this patient comes back with a low T3 is 1.9. And my question is, and she's on T3 only because she had an elevated reverse T3 in the past. So we put her on T3 only to lower the reverse, which it did. Now the reverse is the 5. And we wanted to bring up the T3, but now her body's sucking this up like a sponge and her free T3 is dropping. So it came back that she went 20 hours. Okay, we clarified that. So this is an actual low T3 despite being on T3. So what's happening is her natural feedback mechanism, that shutdown loop is occurring. Again, we don't really care if you have a thyroid problem, it's going to happen anyways. If your thyroid isn't making enough of thyroid hormone and you're suffering with symptoms, and who cares if we negatively shut it down? It's not doing its job anyways. I mean, I work in analogies. I love analogies. I guess it would be something like you keep paying an employee to do a job that they only do 2 hours a week, but you're paying them for 40. You know what I mean? It's like, why are you keeping them around? Why don't you just bring in extra help? Because you're only getting 2 hours of work done, but you're paying for 40. So your business is going to suffer. Same thing. Why would you want to go the natural route and have your thyroid only do 2 hours of work a week instead of 40? Your body's going to suffer. So if you have to bring in extra help, i.e. thyroid hormone replacement therapy, who cares? You need to bring it in anyways. And that's why it pisses me off when doctors look at TSH. It's like, who cares? So their TSH is low. So the pituitary isn't screaming at the thyroid. Oh, well, we're replacing their thyroid hormone. So we need to look at free T3 and free T4 for that, because that is a thyroid hormone, not TSH. But anyways, back to the scenario. So now this patient is on T3 only, and I'm seeing this low reverse T3 at a 5. So I say, okay, let's try now to add in a little bit of maybe Armor, maybe Synthroid. And this is where I needed my nurse practitioner to give me more information, which I'm still waiting on. So literally, as I record this, I'm waiting for the feedback to come back before we determine what to do with this patient. And then I said, and how is she feeling? And we also need to increase her T3. So we're going to increase the T3 hands down. But I need to know, has she done okay increasing the T3? She's already at 20 micrograms twice a day. I would like to take it up much higher unless she's sensitive, unless she kind of is more anxious or sensitive to the T3, getting kind of jittery. Then we want to come over here and we want to say, okay, if she can't tolerate a rapid increase in the liothyronine, let's come over here and add some Armor, because we know she can convert. We don't want to add too much. You don't want to push that reverse T3 up too high, but we have some room to move here with this low reverse T3. So maybe let's add in some Armor Thyroid, 30 milligrams, maybe 60, not quite sure. Need to know how she's feeling. And that would also increase T3, because we're hoping for proper conversion of the T4 to T3 plus the added T3 in the Armor. Now, if she says, you know what, she's been doing great with the liothyronine, no anxiety, doesn't have a history of that anyways, tolerates it well. Okay, then let's add in maybe 25 micrograms of Levo and increase her liothyronine. Let's take that to like 35 twice a day. Let's take her from 20 to 35 twice a day. That's adding in 30 micrograms of T3. That should be enough. And again, this is where that nuance, it's a gut feeling. I can't tell you. It's just, I don't know if you want to call it a gift. Maybe I'm the thyroid whisperer. Before I got the term thyroid fixer, because that's what I do. I fix people. People ask me all the time, what do you do? I'm like, I fix you. That's my elevator pitch, right? I fix you. I fix broken thyroids. I fix broken hormones. I fix broken metabolisms. I fix you. Because if we fix your hormones and we fix your thyroid, then we fix your life. That's where that came from. But could I also be the thyroid whisperer? Yeah, I could. It's just a knowing. It's a gut feeling. It's a knowing. It's when I get to know you and I get to know your symptoms and I take in your labs, we just know what to do. And I'm not saying we hit it on the mark from go. Sometimes it is a little bit of trial and error, but I'm just saying in this case, it's like you just feel, you're like, okay, she needs this increase. We got to bring up that T3, but we have some room to move over here with the reverse being low and the T4 being low. So maybe we increase this and we increase that at the same time. Last scenario for you. How do you know if it's time to change up your medication? Well, it could be that it's your symptoms. not getting any better. But bouncing off of that, if I say, okay, your symptoms aren't getting any better, so you have to change your thyroid medication, I have to put a maybe in there. What if your hormones are in the tank? What if you're insulin resistant? What if you're eating like garbage? That's going to hinder whether or not we need to increase your thyroid medication, because you have all these other things going on over here that mimic the hypothyroid symptoms. So whenever we're determining whether or not we have to change, increase, reduce, whatever, we'll just say change your thyroid medication, we have to look at the whole picture. If your thyroid labs look darn near optimal, and I'm looking at them going, man, I don't know, right? Free T3, it's a 4. Reverse T3 is a 7. TSH suppressed, we know that, yeah. Free T4, I don't really care about. I really look at reverse T3 and free T3. Antibodies are coming down. Doesn't even make sense why you're not losing weight. Let's go over here. Oh, look, your insulin's a 10, so you're still insulin resistant. Your testosterone, are you taking your testosterone? Because your testosterone's only a 20. What's going on here? Are you not taking it? Are you not tracking? Do you happen to, maybe you're not tracking your food, and maybe you're taking in way more carbohydrates than what you think, which is why you're still insulin resistant, which is why your glucose is still high, which is why you're gaining weight. Or it could be your testosterone. Oh, look, your FSH is climbing above a 25. It could be that. Oh, look, wait, you're really stressed out. That's coming into play too. So we have to look at all the other factors before we just go changing thyroid medications. Sometimes you might need a change. Sometimes you might not need a change. You have to blend your labs with how you feel. The answer to that question of how do you feel? And once we can bring those two things together, your labs plus your symptoms, then we can map out a really nice course of treatment to increase, decrease, change up your thyroid medication. So again, if you're on T4 only, yes, you need a change. That's hands down. You're probably taking too much T4 and your reverse T3 is high, or your reverse T3 is normal and your free T3 is in the toilet and you have a bunch of symptoms. You need a change of thyroid medication if your reverse T3 is high, period. So I don't even care if you're on Armour. Again, if you're not looking at reverse T3 every single time, or your doctor isn't looking at reverse T3 every single time, that's a problem. You need to know that reverse T3 number to know how you're converting, especially if you are on any amount of T4, any amount. You might need a change of thyroid medication if free T3 is low and you still have a boatload of symptoms. There's no one size fits all with T3 medication. You might be optimized on 10 micrograms. You might be optimized on 150 micrograms. There is no one size fits all. It's all about moving nice and slowly, increasing slowly, tracking your labs, tracking your symptoms, making another increase to see where you land. Now, some of my patients, they'll increase and they'll feel jittery and anxious, and we'll know that we went one step too far. We got to bring it back down. They won't even feel right at a higher dose of T3. I've never experienced that elevated free T3 feeling, hyper feeling, except when I took too much iodine one time. But I would say it's a feeling like you're on edge, agitated, kind of crawling out of your skin, maybe a wired and tired feeling. And then when you feel that, that's when you know it might be time to back down, back off of your T3. And I've had patients come down by 5 or 10 micrograms and they're like, oh, that did it. Okay, I'm good now. That's all I needed. That's all I needed to do to make this change my body. I'm good. That's it. That's all. You have to experiment sometimes. I would want you to experiment while working with someone that can hold your hand through the experimentation process and properly guide you. Because the other problem is, and we've had a couple of patients that we had to yell at for this, is they'll just change on a whim. They'll change day to day. They'll change week to week. And I'm like, wait, now we're testing you and I have no idea because you've been changing so much. I don't know what we're looking at with this test. Are we looking at 10 micrograms of T3? Are we looking at 25 micrograms of T3 because you've been bouncing all around? You put in the T4, you pulled it back out again to see how you'd feel. It doesn't give us anything. So you also have to be consistent to know whether or not you need a change of thyroid medication. Because if you keep changing things, then we don't know what's working or what's not working. Because changing too often, we don't know what's not working because there's too much change. Listen to your body. Look at the med that you're on. Look at who you're working with. And are they listening to you? Are they coming back with different ideas? Are they testing everything? Are they open to trying medication outside of their comfort zone? So what I mean by that is, and I'm going to digress here for a second, I have met functional and integrative practitioners and have had patients come to me from them that say, well, I only do Armour. Okay, why? I mean, you're no better than the conventional doc that says, I only do Thyroid, I only do T4 because that's all you need. If you're not open-minded enough to know that patients might need something outside of your one freaking medication, then move along. Don't touch anyone's thyroid, please. Don't call yourself functional. Get out of this space. Go back to your conventional training and quit harming people. Because kudos to you, golf clap, for doing Armour. So you're giving somebody a little bit of T3, whoop-de-doo. You're not giving them what they need. You're giving them Armour, but their reverse T3 is too high. What good are you doing? You're no better than giving them T4 only. You have to be working with someone that will blend, will personalize, not scared of T3 only if you have to go that route, not scared of a tiny little bit of T4 plus a lot of T3, not scared of blending Armour and T3 together, because there are multiple combinations and multiple different options that we can do for you to get you optimized. And it's all about finding what's going to work for you and your body. There is no one size fits all. So the bottom line of when do I know that it's time to change my thyroid medication? Wow, what is that bottom line? The bottom line for when do I know if it's time to change my thyroid medication would be the blend of your symptoms, how many are still there if you're trying to get optimized, your labs, what do they look like? Does it show room to move with those scenarios I went through? Or does it show that it's pretty darn perfect and maybe we should look elsewhere? So I guess I could do like a choose your own adventure. Remember those books? Choose your own adventure, little diagram of start here. How do you feel? Shitty. Okay. So we're going to go up here and we're going to go, okay, feel shitty. How are your labs? If we go over here and we say labs are perfect, optimal, everything's optimal. Then from here, we go back down here and we say, how are your hormones? How's your insulin? How's your liver? How's your gut? How's your adrenals? Did you do a 4-point saliva cortisol panel? Let's check all that. Let's go back over here. How are you feeling? Shitty. Then we go here. We say, how are your labs? Shitty. So now it's time to change. And that's where we go through the scenarios, which I won't go through again, of reverse T3, free T3. What are you on? What do we change? Here we go. Now, even if we're over here on this path of shitty, and we're changing up thyroid medication, we should still circle back down and make sure that hormones, insulin, gut, adrenals, all that good stuff, liver, that's all working properly as well. Still got to take a peek at that. But based on my little Zen diagram. I guess this is a Zen diagram because we're pretty chill here. Based on that, I think we have a pretty good layout as to what you need to do and when you need to change. And then I guess we need to add one more, right? How do you feel? Jacked up. Okay, what are your labs? Free T3's high. Let's drop the T3 a little bit. That's it. It's that simple, but yet not at the same time. It's simple to me. I can do it in my sleep. I try to teach you and give you all the tools that I possibly can without sitting here looking at your labs. But at the end of the day, it really is fantastic to work with someone that knows what they're doing. So that might be the big change that you need right there. Fire your doctor. But if you don't have to go all the way to that route, then hopefully these little tips will help you. Hey guys, thank you so much for listening to the podcast. I hope you loved it. And as always, if you would be so kind to leave a review if you are listening on Apple Podcasts, that would be absolutely amazing. I read all of them. Also, anything that you hear on this podcast is not intended to diagnose or treat any kind of medical condition. So we always recommend that you check with your medical provider, your doctor, your nurse practitioner before implementing anything that you hear on this podcast. And if you want to find out more about working together, you can click the link below in the show notes to book a discovery call. And there you'll be talking to a member of my team. They are an extension of me. They are amazing. And you and I will talk after that once we get you all signed up and you and I get to work together. All right. I hope to see you soon.